This is Dr. Daniel Paul with Easy Orthopedics. I'm an orthopedic surgeon, and today I'm going to tell you how to pass an independent medical exam. Now, independent medical exam, also known as independent medical evaluations, are done when someone has a case or ongoing treatment and they want a third party to come and say, was the treatment appropriate and does this person really have what they say they have? So you may find yourself in this situation if you've had a workers' comp claim or a personal injury claim and someone is ordered an independent medical exam, which means that you need to go and basically get examined by this doctor and they're going to write their opinion. Now, it's not like a normal visit in the sense that they're not going to give you treatment recommendations, and that document is actually not part of the medical record. It's actually a legal document that the doctor can only give to the person who's paid for the exam. So you may be a little bit worried. Maybe you have your case going on. You're saying, well, how do I get past this person that's going to try, to ruin the whole case? And so it really comes down to this. If you're doing this exam, you want to be honest. Just be honest with your symptoms. Be honest with how you feel. Be honest with what the treatment you went through. If you had pre-existing injury, be honest with that. That is your best route to getting through this. If you start making things up or saying, the doctor, and I'll say in my case, I can usually tell. I can tell if you're exaggerating. I can tell if things don't add up. You also got to remember, they have your whole medical file. So they've already reviewed all this. So you really want consistency. Whenever there's inconsistencies, the doctor usually records it, and that makes things much more difficult. So your best bet is to just be honest and, just be agreeable to the exam. That'll make things better for everybody. So it may happen that an independent medical evaluator is supposed to be truly independent. That's how I do mine. I'm not for one side or another. I'm just going to state my opinion that I really believe, because I need to be able to support that. But you'll find that with some IME physicians, they tend to go to one side or the other over time, and they may do only defense, or they may, do only for the plaintiff. And then you may end up going to an IME doctor who's known for being very difficult. In this case, it's going to be tough for you. But again, just be honest, and you may have to get your own IME on the other side to combat the IME that they're getting. That's probably your best recourse. I would certainly talk with your lawyer about that before you decide to do that. But again, I keep reiterating it. If you start making things up or exaggerating, it's usually pretty obvious, and it'll make things a whole lot worse. So that's my recommendation from an orthopedic surgeon that does independent medical exams. I think that just being honest and just being genuine is the best thing you can do, so you end up doing well. And just remember, the independent medical evaluator is not out to get you. They're just there to record their opinion. I hope this information was useful to you. If you have any questions, feel free to leave them below, and I'll be happy to respond. I come out with new content every week, so please subscribe to my channel and hit that like button. Thanks for watching.